Well, Ulrich, thank you very much for inviting me here, and I'm really excited about not only being here but also being able to collaborate with this initiative on trying to set the incentives for academic research in a different way, and that means involving the citizen. Now, as Uli mentioned, it took me 37 years of academic research and scientific publishing in the field of Drosophila genetics until I realized that Drosophila is 600 million years remote from humans. And if we want to understand humans, we better start to study humans. And humans have, in addition, an additional advantage. Our flies never talk about their phenotypes. We have to torture them, we have to measure them, we have to dissect them in order to find something out. But now, of course, humans talk about their phenotype. They go to the doctor and explain what they have. And even more importantly now, they have this in their pocket that records their phenotype continuously in a way that is going to be very important for medicine, for precision medicine in the future. And so we have to find ways to involve citizens. And I was so excited about this citizen science aspect about 8 years ago now, that I suggested to my family that we start citizen science, and I gave them as a Christmas present their genome analysis. Who of you has done their genome analysis already? Okay, so we have 2 people. Hello, we know each other. So of course I told our 3 sons, said, hey, this is cool. Yeah, if you pay for it. It was actually 400 euros or dollars at the time, with the company 23andMe, this Google spin-off company. I also told my wife that if we did this, it would also become apparent if 1 or all 3 of our sons are not from me. Because that's the only sure thing you get from a genome analysis. And luckily she laughed and said, yeah, it's no problem. But just think if she had said, I don't know, I have ethical concerns with this kind of analysis. Anyway, so everything went fine, but this actually got me started, and I've followed 23andMe since then. There is a company that is now $1.5 billion worth. They have 1 million genomes of people. And I said, wait a minute, they gave us a great service, but we're giving our data away and they make the big money with it. And so we're giving data away continuously with all the free apps we generate and the consent we give to researchers, etc. Something's wrong here. Can we not think of a different way to control access to our data and actually as a society share this revenue? And that's how this cooperative idea came about, that we as a cooperative control the access to our data. Because after all, in medicine, the patient data it's all about patient data. The patient is at the center, even more now that he's recording continuously health-relevant data with smartphones that he at the moment gives away continuously. And so what we want is to put the patient citizen in control of their data. And this is really important because you are, as a citizen or as a patient, you're the ultimate aggregator of your data. Neither your hospital, nor Google, nor Facebook will ever be able to have all the data from your genome data to your shopping data to your X-rays and your blood readings together. You're the only one who can authorize that. And so it's very important that we engage citizens actively. So that is really the need. The opportunity is, this is a study, we've done several studies with Effie Vallena, a bioethicist, now professor at ETH in Zürich, where we ask students whether they would do a genome analysis a la 23andMe. And what you see is that 60% of them says yes, and the interesting thing is that if you ask them why they would do it, is yes, they would understand something about their disease risks, but most importantly, even higher, is to share these results with the scientific community. And these are 1,500 students that responded to this survey. We've done the same thing with elderly people. And elderly people, smaller number, 70% said they would do a genome analysis and to share it for the scientific community. So the possibility, the willingness of people to share information, if it is done in a fair setting, is incredibly high. And so this is a huge untapped potential. The problem, however, is, of course, that we're starting to lose trust in Facebook and Google, and we increasingly realize that we are more and more manipulated. And then you read things like that, you know, hospital records are sold for billions of dollars. I mean, IBM just bought 200 million hospital records, anonymized. It is possible. So it's a huge economic value. And there is what the World Economic Forum calls this sort of increasing socio-economic imbalance between the individual and the big internet companies like Google and Facebook. So we're living in an age of digital feudalism, because in the last 10 years we've been just used to download apps for free, giving data away for free, while we naturally pay, you know, €2, €5 for a coffee in any restaurant. But for an app, why should we pay? So, but it's not too late. I think we can change that. And the solution to change that builds on one of the true facts. So personal data is a new resource. And it's a very interesting resource for two reasons. First of all, it's a resource that we all have similar amounts of. We're all billionaires in genome data, whether we live in Berlin or in Tanzania. And we have the same number of steps, the same number of heartbeats. So it's one of the unique assets that we all have the same amount of people. The second distinguishing feature about personal data is that it's copyable. You can request a copy of your data, and that's exactly what we request. We want the rights to obtain a digital copy of all your personal data. And this is now, interestingly, also in the European Data Protection Regulation. Article 20 specifies exactly that. Data portability allows you to require a copy of your shopping data, of your medical data, etc. And you don't take the data away from Google or from Facebook or from Tesco or from Migros or from the hospital. You just want a copy, and you can aggregate this copy. So then that needs a new infrastructure, like banking infrastructure, to store your data. We are saying we should not follow the lead of the normal Swiss banks, but actually put this up as a citizen-owned cooperative. And the cooperative, as die Genossenschaft, is a very traditional form of enterprise with a one member, one vote principle, exactly matching the fact that we have similar amounts of personal data. And it's not for profit, because we don't want to suggest that your data is very valuable. It's the aggregation of all our data that is valuable together. And so that's why the revenue should not only go to Google and to Facebook, but it should go to society. And in this cooperative model, it will actually go back to society. And looking at the billions of dollars that are paid for simple medical records, if you combine all your smartphone data together with genome data, which you can, this is a huge amount of economic market that we can generate in a democratic fashion. And so this is the project that I'm just briefly now highlighting. So it's a project called MeData for MyData.coop is the ending for cooperatives, the international ending for cooperatives. And Serge Bignon is my colleague here from the University of Applied Sciences in Bern. Medical informatics, he is really sort of with me the driver behind this project, and he really understands something of IT and not only of fly genetics. So these are our partners in Switzerland, university hospitals and ETH and University of Applied Science. This is the picture that Uli already showed. So the idea is very simple. Like a bank account, we all have bank accounts, we all do e-banking. Now you have a bank account for your medical data, for your shopping data, for your education data, any kind of data you can store in there. Usually through apps or through interfaces. You have the key to your data. You are the only one who decides who to share this data with. And you can share it for research. You can share it for a second opinion with your doctor. But it's only you who has the key. You can have it locked in there. This is the cooperative project, the cooperative framework, which leads to this sort of new trust-promoting framework because it is citizen-owned, it is not-for-profit. We specifically exclude that you can sell your data to the highest bidder. There are many platforms where you can do that. We don't want the wrong incentives. We don't want you to sell your data. It's like donating blood. In Germany and in Switzerland, you don't get paid for donating blood. In the United States, you do. The quality of blood is completely different. It's open source, it's transparent, it's secure, every individual data set is encrypted, and it's regional. That's why we promote the formation of cooperatives in different countries, like here now also in Berlin. So this is the ecosystem. The cooperative is not for profit. It runs the IT platform that was developed by ETH and University of Applied Sciences. It's governed by the General Assembly. It has its own ethics committee. And even though this platform is not for profit, it allows an entirely new app economy or service economy, because now startup companies can generate nutrition advice based on your genome, based on your steps that you take, and based on your blood value. Nothing has been possible this way. And these can be for-profit companies, just with the exception that we and the ethics committee looks at the general terms of agreement of these companies so that they do not sell the data to third parties. The data stay within your account. This is the IT structure of the platform. I don't have to go into detail, but since this basic infrastructure has been security checked and is already in place, any app or any research project that can be developed with a patient-reported outcome app, for example, can be developed very quickly within months, because we use these standardized interfaces, these FHIR interfaces. So let me tell you briefly about use cases. So this is the first use case that we did with obese people at the Inselspital in Bern, where after bariatric surgery, the physician said, I don't know what the patients do when they get out of the hospital. So we asked the patients whether they would carry a dedicated smartphone app where they record their steps, the weight, and the well-being. Everyone agreed. Everyone agreed, and they agreed because they were part of this study. They were part of this study. They were not paid for that, it was extra, but they commented in this every day. And there's only 70 people, but it showed us that there is a real need and a real opportunity to participate. This is another study that just started on cancer patients after chemotherapy. Again, outcomes research. How do they recover after the first chemotherapy before they get the second one? The oncologist has no idea. He wants to know. People are ready to participate. This is a study on type 2 diabetes with, again, Inselspital. This is more about communicating between the healthcare team and the individual to move appointments, etc. Again, something very easy that can be done on this platform. Finally, this is the more involved application, again, a tablet application for MS patients, where MS patients are asked to do cognitive tasks, which they normally would have to do in the hospital, at home on a pad, cognitive skills and motor skills by following different lines, etc. We're developing this prototype now with healthy people. Again, citizens help us to calibrate this app, then going into patients and eventually using it for a clinical trial. Now, since these are all relatively small, diverse applications, I want you to know something. Any of these apps, because any of these use cases can be immediately replicated in any other country, because the needs of the patients are the same everywhere. So if we have a MeData platform here in Berlin, this app or any of the other ones can be replicated immediately. So we have replicated study. Now, these are now the larger projects, more citizen science oriented, a project where we're using glucose sensing with a mobile glucose sensors, where we invite healthy people to participate in a real world study how your blood glucose levels change during the day when you eat. There is hardly any data on this. And we are sure that we get 2,000 or more citizens to participate in this. So just wearing a sensor, many of them will actually buy the sensor themselves. It costs €60 now, a dedicated smartphone app. They photograph the food they eat. There will be crowdsourcing to annotate the food and machine learning, and we also analyze their microbiome. No data on real-world nutrition data. A lot of interest. Even my wife immediately subscribed to this trial. This is another trial on hay fever allergies. Again, something that a lot of people have. We want to target 100,000 people in Switzerland, and I think it will have a lot of media coverage. We can transport it to other countries immediately. There is no real-world outcome data on this again. So this is basically the idea, that we want to promote the idea of this democratization of the personal data economy without taking anything away from the existing hospital repositories and biobanks, etc., but we can receive a copy of that. And we want to do that with our partners, and the first partner is here, Berlin Institute of Health and Uli, in particular the Netherlands, and also I'm very happy to see Alistair Buckham here, because we also have a collaboration with Oxford. So I hope with this we can generate an additional new democratization of the personal data economy, of precision medicine, which is a clear alternative to the winner-takes-it-all Silicon Valley strategy of these companies. Thank you very much.
Because you were so economical with your time, I said one important and one question, and the other questions later, please.
Hey, Schellenberger, nice talk. I like my data. So if I would decide to join or to join my data and give my data to the system, are you also help me to prevent that my data don't go to all the others, like now, to Google and so on? So the data are produced on smartphones, and I want to give them to you, but maybe I don't want that everybody else in the world gets them too.
Yeah, so that depends on what kind of smartphone app that you've downloaded. If in the app that you downloaded for free, it says that this company will sell the data and make money on your data, we cannot do anything. But the copy of the data that you send to MeData, that is where you have the key. And you are the only ones who decides what happens to this copy. What happens to the original data is we cannot control. Well, I think we have to rethink our behavior also, because if we start to pay for these apps, like we pay for coffee, we can impose regulations that they don't sell the data, right? We have to become the data protection regulation really goes into this way. And we want to enforce both the data portability and the right to a digital copy in Switzerland.